This week saw the start of a new parliamentary inquiry by the all-party group on breast cancer.
Minister Anna Soubry has just taken her seat and she's very welcome, and we'll be hearing from her very shortly. Just before we do, I just wanted to...
The Conservative MP, Steve Brine, co-chair of the all-party group opening proceedings. All-party groups have no real status, but David Cameron's promised to respond to this inquiry as if it was a full-dress select committee. They're looking at government efforts to improve the screening of breast cancer, and in particular at the treatment of older women who develop it. Steve Brine said there were concerns that many older patients were in effect written off rather than treated.
I think there has been a view that, well, something's going to get you. You've had a good innings, all of those cliches, and 70 is not as old as it used to be, and the screening programme is being increased from 70 to 73 and probably beyond. Certainly the trial seems to suggest that. And what we're saying is that, actually with the right treatment, with the metastases picked up before they spread and become secondary breast cancer, which is sadly not treatable at the moment, we can save a lot more lives and drive down the 12,000 women that we lose every year to breast cancer. And that has to be a good thing.
Anna Soubry, the Minister for Public Health, agreed.
There are unfortunately too many cases of people who presented at a particular age, and they know that the medics have sort of said, well, you're 70, love. You're on your way out anyway, aren't you? Which of course is absolutely outrageous. It doesn't matter what age anybody is. They have a right, just as they do when they're 20 or 30, to proper diagnosis, to proper treatment, and everything to ensure that they live as long and as happy and as healthy a life as anybody else. And so I think there is that recognition, which is why we've extended the screening programmes, we've extended the age, and why we've run this campaign particularly. And we will evaluate it. And having evaluated it as to whether it's been of benefit and of use, we will consider whether or not it should be rolled out as a national campaign.
And she added that age discrimination in the NHS was a reflection of society.
But I don't take the view that health workers are any different from anybody else in society. I'm sure we're all guilty of it, of ageism, of looking at somebody and thinking you're a certain age, you're near to the end of your life, and we don't put the sort of care in. We're ageist, simply. And I think that across society we are changing, and I think that will happen to health workers as well.
Another co-chair of the all-party group, the crossbench peer, Lady Morgan of Drefellin, said that better treatment of older patients could help the government meet its goal of saving more lives.
The government are very keen to save an additional 5,000 lives, and it's really clear that if they were to focus on improving outcomes for older women with cancer, then they could do that. There's some real opportunities here, and it's really important that they start to pick up on that as soon as possible.
Another worry was that the new decentralised structure for public health might mean a postcode lottery, with some areas far less effective at anti-cancer strategies than others. Anna Soubry told the Conservative MP Nick Dubois she hopes standards could be driven up everywhere.
When it's at such a local level, there's a real role for people like yourselves, good constituency MPs, and for all the great cancer charities as well, to really make a big difference.
It's very refreshing to hear that. Do you think we run the risk, and if so, how can we help overcome it, of some areas being much more effective and committed than others,
Yes.
which is a slight risk?
I think what will drive it is our plans to publish the results and the evidence. See, at the moment, local authorities have had no involvement in the delivery of public health. They've inherited from the PCTs, and some PCTs have done a much more brilliant job, frankly, than other PCTs. So they don't all start with the same basis, if you like. But because we have increased the amount of money that we are giving to public health, it's a serious deal. Some places are getting up to 10% more.
I can vouch for that in my constituency.
Exactly. Local authorities know what their money is for 2 years, and they've got an increase in their budget. So forgive me, but I think they've got no excuses, if you like. And so what we intend to do is that we will begin to publish the statistics as to the successes of where they are or they are not delivering on public health issues, like, for example, cessation of smoking, for example. We won't be unfair, we will compare like with like, but in time we expect everybody to be making the same progress.
Well, after the hearing, Steve Brine was pleased at what he'd heard from the Minister.
It's a good start for us. What we need her to do, though, is actually to back that up with action. We want to make sure that as the breast screening programme increases and the age extension comes into place across the whole country, that the screening programme has the capacity to cope with those people, and then the health service has the capacity to treat them as and when necessary. And that's where we need constant ministerial support. So many people think breast cancer is done. Every time there is a high-profile death from breast cancer or somebody who gets it or beats it, the number of people coming to the screening programme rises sharply. But people think because of that, because of all the publicity around breast cancer, that it's done. But I just reiterate that it's 1,000 women a month, 12,000 women a year die of this disease. That is your mother, your sister, your daughter. And it's a tragedy and it's wrecking lives, and we aim to stop it.
Steve Brine.